If your child has any kind of blacking out, please go to the hospital. If your child has had a head injury and you're not sure and they're just worried, go to the hospital. If there's any kind of loss of consciousness, go to the hospital. Let the doctors decide if your child needs a CT scan or not.
Hello and welcome back, our online viewers of Pediatrics To-Go family. I'm Francisca Lename, your host, and today on Pediatrics To-Go, we have Dr. Ekuase Sanusi. She's going to be talking about minor head injuries.
Thank you, Francisca. Hello, everybody, and today we're talking about minor head injuries. And the reason is we see quite a lot of children coming in with minor head injuries. So when Johnny or Kola or Aki falls and hits the back of his head or the front of his head, or Rachel falls and there's trauma, she slipped, she fell, she landed on her head. What are the things that are important that we look for? So we always ask, tell us what happened. A history of loss of consciousness. My child fell. Was there loss of consciousness? Were they out for a little bit? No, they weren't. That's always a good thing. When there's loss of consciousness, that already takes it to a higher level of injury. And then if there was loss of consciousness, how long were they out for? 20 seconds, 30 seconds, 1 minute, 2 minutes, 10 minutes? Were there any associated seizures? If they did not have loss of consciousness, no seizures, that's great. The other question we always ask, what heights did they fall from? Because anytime children are falling from a height of 5 feet or more, that's not minor head injury, that's significant head injury. I had a child once whose brother was 6 foot tall. The child was on his shoulder and they were just playing around, and next minute the child slipped from his 6 foot height to the ground, hit her head. We did an x-ray, skull, she had a skull fracture. We had to send her to the emergency room to get a CT scan. So it's important to get the history. It's important to get the mechanism of injury. If a child is falling from the bed, bunk bed, which is about 5 feet high, onto their head, that's significant head injury. That child needs to be evaluated in an emergency room that will do a CT scan for them. So the other things we ask, after the head injury, how long ago was it? Within the first 4 hours of head injury, we usually want to observe children very carefully. Was there any behavior changes? If there was no loss of consciousness, is the child acting different from normal? If parents say, oh, he cried or she cried, and within 4 hours, the child is looking good, that is good. If there was vomiting after head injury, that's not good. So when children have head injury, depending on what they look like or what they're doing after the head injury, please don't wait to have them being seen. Take them to the pediatrician or your GP so that they can be evaluated, especially within the first 4 hours if you're worried about the child. If the child had a head injury and they cried and they're acting normal, we don't worry about it. But in the first 4 hours, you always want to observe them very closely. And that's because if there's anything serious that's going to happen, it will happen usually within the first 4 hours. Okay. After 4 hours, if the child is still complaining about a headache or is just not looking good, anytime within the first 24 hours after a head injury is important to be evaluated for the child. So when children come into our urgent care or into our hospital here in Lagos, and we say to them, okay, tell us the history, what we're looking for is, was there loss of consciousness? If the parents say yes, then we're also looking for, is the child acting normal? No, the child is not acting normal. We're looking for vomiting. Is the child vomiting?
Yes,
how many times?
How say child vomits like after a head injury? What's the cause?
Very good question.
How does it relate?
Very good question. When children have head injury and if they have bleeding in the brain, remember that the skull of children, there's an anterior fontanelle which closes usually at 9 to 18 months. As they grow. Mm-hmm. And if there's head injury and the anterior fontanelle is closed, we have the posterior fontanelle which closes at 3 months. The anterior closes at 9 to 18 months. So when children have had a head injury, especially when they're very little, if they are less than 2 years old, we like to observe them and we like to do CT scan for them because they might have a bleed in the brain. And if you don't have a high index of suspicion, you could miss that. So if they are older than 2 years old, the anterior fontanelle is closed and they start to have vomiting more than once, it's because they have increased intracranial pressure. So increased pressure in their brain. Yes, and if a child has increased pressure in the brain, you want to do a CT scan because they will have 3 things. They will have vomiting more than once. Oh, wow. So if they're vomiting 2, 3, 4 times, that's not the time to say, oh, let's watch and see. No, you take them in for a CT scan immediately. CT scan is preferred just because if there's bleeding in the brain, the CAT scan will be able to localize that bleeding. And if the child needs to have surgery to remove that blood clot in the brain, then you want to do it sooner than later. You want to get a neurosurgeon on board to get that blood out of the brain, because there's something called herniation of the brain, where the brain now gets squished by the blood and it starts to come through the main hole in the bottom of the skull, which is like a very bad complication of head injury.
Right.
So there's something called the PECAN criteria that we use. Now it's a bit more advanced. Our audience don't need to know what the criteria is. But when children come in, head injury, they've fallen from a height straight onto their heads, especially when it's 5 feet up. 3 to 5 feet is if they are smaller babies, 3 feet is significant, if it's significant for 5 feet or more is significant for older children. We like to get a CT scan. If we get the CT scan and the CT scan is normal, we're good. Now there's different side effects to head injury.
Okay.
So when children have had a concussion, we use that word for any kind of head injury that has caused shaking of the brain. So usually when there's a concussion, that can cause a sequelae of headaches. So the children might have headaches for 1 week, 2 weeks. Sometimes those headaches can last for weeks to months. But most children, if they've had mild head injury, which is what we're talking about today, after 7 to 10 days, the headache should be gone. Most times they might have nausea, but they might not vomit. Or if they vomit and it's only one time, we don't worry too much. If they keep vomiting, then definitely they need to be seen. They need to be evaluated properly. Most of the children who have had head injuries, we don't like them to be on ibuprofen, because ibuprofen is a non-steroidal anti-inflammatory and it can worsen brain bleeds. Oh. So we usually recommend, if your child has a headache, give them Tylenol. And then the other thing, Tylenol, acetaminophen, paracetamol.
Okay, for Nigerian.
For Nigerian, yes. Ibuprofen is more Nurofen, which is what we have here. Motrin, Advil, those are ibuprofen. But we don't like ibuprofen for children who have had head injury. So we usually tell children, parents, that monitor your child for the next 72 hours. If your child has any of these symptoms, vomiting more than once, take them to the emergency room for a CT scan. If your child has behavior changes, or your child is sleeping too much and it's hard to wake up, take them to the hospital so they can do a CT scan for them. If the child doesn't have any of these, we tell parents, give your child acetaminophen or Tylenol or paracetamol. They're all the same. They're all the same class, yes. Okay. Not ibuprofen, not naproxen, not any of your non-steroidal anti-inflammatory. And if the headaches persist for a week, your child should not be in any kind of physical activity. Some children, they like to play basketball, football, soccer. Yeah. So your child should not be running up and down, especially after they've had a concussion, which is a shaking of the brain. Now, if the child has a long-term effect of the head injury, like some children might have severe headaches that just don't go away, they need to be followed by neurology.
So not all migraines are migraines. There could be effect of like head injuries from years back.
No, migraine is usually familiar. That's a whole different topic. Well, a lot of children who have migraine, there's usually a family history of migraine. And that's totally different, because the arteries in the brain that supply the brain, there's a circle of Willis and all those different arteries that supply the brain. Many times those arteries go into spasm. And then children have migraine. So migraine is more of a chronic condition that tends to run in families. It's different from head injury, where you have those are what we call post-concussion headaches. So if you have a concussion and you have a headache, usually in 7 to 10 days, it should go away. If children are off from school for a couple of days, that also helps. And we also recommend cognitive rest, where you rest your brain. So that's when most children, when they've had a head injury, they don't want to be in a loud room, because that irritates the brain and makes the headache worse. They don't want to be in a room with all these lights, so they like dark rooms. It affects, yes. They have photophobia. That can affect their headaches. So you want them to be, most times they want to be in a quiet, dark room, and they want to not do too much. That's not the time to be on your phone and answering Facebook, sending Facebook messages and saying happy birthday to everybody. No, take a break from the cell phone, from the computers. And we call it cognitive rest. It's actually a form of therapy for head injury. So once children are out of PE, they're out of school for 2-3 days, and they've had time to rest, those headaches tend to get better. Now, over time, if it's not getting better, then you want to have them see the neurologist so that the neurologist can follow them. Now, there's a part of the brain that we don't like when there's injury. There was actually a popular actress that died. She went skiing in America, and she had a head injury, and she hit this side of the brain.
Temporal.
This part of the brain, this part of the head, anytime we have any injury here, we don't like it. And that's because there's an artery there called the middle meningeal artery. And I tell people because some people might want to know what the artery is. When that artery, if there's injury to the brain, like this actress, she was skiing and she hit a tree or something. She hit this part of her brain. She blacked out. That's called a lucid interval. And then she woke up. Now she fell, she was unconscious, then she woke up. I said, oh, I'm fine. Now, between the time of her blacking out, having the lucid interval, coming back and acting fine, the bleeding continued because the artery here kept on increasing the pressure in her brain. Those children, they are alive, they are active, they are acting normal until they reach a point of no return where the bleeding is so much and then they end up herniating. That actress died. So if you have an injury here, the temporal part is both sides. The middle meningeal artery is something that we don't play around with. Anytime we have children coming in with injuries here, or they have like a history of blacking out transiently, those children, according to the PECAN criteria, will follow it, but those children usually get a CT scan to make sure that
they go for surgery as well.
If they get admitted to the hospital, and if whatever needs to be done is done. There's sometimes, well, what the neurosurgeons do, they do in the hospital. That's beyond the scope of what we do. But the doctors that are taking care of these children, they know what to do. So it's better to go to the hospital and get it checked out than to wait and then that lucid interval, you think, oh, the child is fine. Meanwhile, there's a bleed. There is like almost a volcano waiting to erupt. And then that thing bleeds and then the children become unconscious and then they reach the point of, and then they end up dying. Wow. So please, this is part of the education that we're giving. Your child has injury to the temporal part of the brain, either side, the temporal part of the head, they blacked out. That is one indication to get a CT scan. If you get a CT scan and everything looks good, everybody's happy. But if you get a CT scan and there's a bleed there, then the doctors will get the neurosurgeons, and the neurosurgeons know what to do. They'll take care of your child so that your child is not end up getting close to death's door just because of that. So if there's nothing else you take away from this, temporal head injuries on each side of the temples. If your child has any kind of blacking out, please go to the hospital. If your child has had a head injury and you're not sure and they're just worried, go to the hospital. If there's any kind of loss of consciousness, go to the hospital. Let the doctors decide if your child needs a CT scan or not. And if you're not happy with the doctor, I always tell people, hey, getting a second opinion doesn't hurt. Some of my parents, I say, when you come back tomorrow, see my colleague because I want a second opinion. And if I'm not sure, I get a second opinion for my patients from my colleagues. So a doctor that tells you, oh, don't get a second opinion because I think I know it all, just be quick to find the second doctor to corroborate what that first doctor has said or to give you a second opinion on what needs to be done. But head injury, don't play with it. Take care of your children. And that's the reason why we're doing this, so that you know what to look for and you know what to expect and you know when to see your doctor. So that's really what I would like to share with everyone.
About minor head injury.
Minor head injury, yes. It might look minor, but sometimes it's not. And that's how you distinguish between minor and not minor head injuries.
And major head injuries.
Exactly, and knowing when to go to the hospital. So
I think for all head injuries, you should actually go to the hospital. Don't even take...
Don't
take chances because you can't tell.
Yes.
You really can't tell.
Yes, and look at that. We wanted to talk about minor head injury, but we've gone to lucid intervals, epidural hematomas. That's what it's called when you have a bleed from the artery here. Epidural hematomas, lucid intervals, mechanism of injury, and then criteria for CT scan. But it's just safer. See your doctor. Let them decide what the PECAN criteria is. Let them decide if your child needs a CT scan. But don't play with head injury. Head injury is head injury, and it can be... You might think it's minor. Let the doctor decide if it's minor or major. So that's really our message for today.
All right. Thank you, Dr. Ekuase, as always, for always educating us on, pediatric information. So if you've gotten to this point in this video, this is the time where you subscribe to our YouTube channel, and so you can keep up with pertinent pediatric information from your trusted pediatrician. So until next time, catch ya. Bye.
Bye.